Tēnā tātou katoa, good evening. There are fresh concerns tonight that hospitals are buckling under the winter strain.
An investigation is underway at Middlemore Hospital after claims a patient left the emergency department due to long wait times, only to return 3 hours later following a life-threatening emergency.
That patient has since died. Health correspondent Lucy Warhurst reports.
Middlemore Hospital says it's under extreme pressure. Now it appears long wait times may be impacting even life-saving treatment. An email sent to Newshub overnight revealed a woman turned up to ED at 1 a.m. yesterday with a severe headache, but was turned away due to long wait times. She returned 3 hours later, intubated, on a breathing tube. She has since died in ICU. The doctor, who wants to remain unnamed, said this woman was a well Kiwi who could have been saved had our health system been coping. The email said the woman had suffered from a major brain bleed. In a statement, Middlemore Hospital said, "We acknowledge this is an extremely stressful time for the family and we have instigated an immediate investigation into the case and circumstances." Earlier today, before Newshub had been able to confirm the incident, the Health Minister acknowledged hospitals are under huge pressure.
A flu season that is bigger than we've seen before, with COVID still having its impact, with staff absenteeism being greater than usual, that is going to put pressure on services.
When the borders reopened, we were warned of an influx of winter illness. This is it. The pre-departure test that served to reduce COVID cases is now defunct. The government is scrapping it from Monday night.
We know they have a very low positivity rate, so this change is a safe change that we're now ready to make and welcome back more travellers to New Zealand.
Which is music to the ears of the tourism industry.
Today's announcement is really good timing for the ski season, especially after all the snow we've had this week, and also for the upcoming school holidays.
But for the health sector, it's added pressure, especially as winter illnesses other than COVID are pouring in through the border.
We're certainly seeing some hospitals and some ED departments and some hospitals really under the pump. We've seen counties Manukau, we've seen Wellington, we've seen Canterbury, Auckland is feeling it as well. This is not a whole bunch more people with COVID anymore, this is people with flu symptoms.
Today marked the 1 million flu vaccine milestone, but there's another 1 million to go.
Health officials want more people to get a flu jab this year, even if, like me, you've never had one before. There we go, 1,000,001.
We haven't seen flu now for over 2 years, so that immunity that we may have had for strains of flu in the past, we don't necessarily have from natural exposure.
So they're calling on more people to get immunised to ease the pressure on hospitals.
Well, Lucy joins us now. Lucy, some breaking news tonight about another emergency department under strain.
That's right, Sam. We've heard about these PINs before, provisional improvement notices. Well, Palmerston North Hospital Emergency Department is the latest to get not one, but 3 from the nurses' organisation, stating overcrowding, lack of staff, stress, untenable workloads. And they say that that's resulting in sick leave, in burnouts and resignations. Now, the hospital has 8 days to respond. Nurses say they have had enough, and yet this is just the start of winter.
Ngā mihi, Lucy. Thank you for that update.